Thank you for staying with us. This is, of course, the South African Morning right here on Channel 403 on DSTV. Let's bring you this now, where teacher unions, Naptosa as well as Sadtu, say that they are concerned at this stage about the number of COVID-19 vaccines which are earmarked for teachers. Now, government has secured 300,000 vaccines for teachers, which the unions say will not be enough at this stage. Talking to me now is, of course, Sadtu General Secretary, that's Mr. Mugwena Maluleke, who joins me now live. Sir, thank you for your time, and a very warm good morning to you. It seems you are concerned. You're not at all, satisfied with the number of vaccines expected to not only cater or to be administered to teachers, but actually education personnel holistically. That number is 300,000 worth of vaccines. Take me through some of your concerns with that.
Good morning, Tumelo, and good morning to your viewers at home, and thank you for the opportunity. Indeed, we are extremely concerned as an organization about the fact that the 500,000 doses that were promised for the teachers could not be reached as a result of some other technical problems that have been experienced. Our concern is that we're facing a third wave, and therefore we had thought that this would then be one of those particular defensive mechanisms that will be given to the teachers as the frontline workers, so that they are then able to provide the service to our country, but also to making sure that we drive the pillars of the economy, as we will then be able to have the children while the parents are at work. So we thought that it would be happening. The other problem, clearly, it is lack of transparency around when exactly will the ministers make an announcement in terms of the date of vaccination. We are already beginning to see some provinces are going ahead and they have made their own arrangements, which we want to appreciate, because some of them will be starting to do vaccination by today, but we don't have exact information of which provinces are those and how many teachers have been targeted and so forth. So yeah, these are some of our concerns, because the administration staff have got to be vaccinated as well as the teachers, because they all work with learners.
Absolutely, and there's also the information that we had been receiving. But with that being said, it seems that that number is definite. The government has, sort of confirmed that they have secured only 300,000. So in the meantime, what do you suggest they should do or can do to try and mitigate this situation?
What they have already decided, we have had the minister speaking during the week that they will then target the 40 years and above, and so that the 300,000 can be used on those. And therefore, as we receive the other batch within 2 weeks, as promised by the pharmaceutical company, Aspen has indicated that they will be able to have around 1 million in a week's time and another 1 million in 2 weeks' time. Therefore, the teachers will also be, prioritized. So yes, indeed, it is going to be about the age, it's going to be about the comorbidity. Clearly, it is that everything is in place, because the EVDS has been updated in terms of the EMS information that is coming from the department. Hence, I'm saying some of the provinces are already beginning to make those particular pronouncements and saying teachers should be ready to do that. So yeah, we would have loved everyone to be vaccinated, and we are still optimistic. And thanks to the overwhelming support from the public and from the Department of Health, we understand the situation. However, our concern is the health and safety of our learners and our teachers and our communities.
Ms. Maluleke, I want to then touch on that point, the health and safety of your teachers as well as your learners, including education personnel, holistically, but placing a focus on the Western Cape. It seems they are concerned because they're struggling with the recent case of COVID-19, saying that they cannot maintain social distancing at full capacity in schools. How do you think this issue can be resolved? Because I'm sure this problem and concern faced by the Western Cape province is not only isolated to the Western Cape. I'm sure many other schools are dealing with this. Hence, we're seeing so many, cluster cases and breakouts of, COVID cases confirmed, within schools, particularly at this time.
Remember that the fundamental principle about fighting this particular pandemic is about social distance. It's about us being able to follow all the protocols in terms of the wearing of the mask and clearly washing the hands as frequently as possible in our schools. So if the schools are not able to accommodate the number that is required, it is important that we go back to the directions. And the directions that have been published recently did not take into account the fact that we'll be in a third wave, and therefore they cannot be implemented as is. We must go back to the drawing board to ensure that the social distance, as pronounced by the president of the country, that social distance is very critical, that we maintain the social distance. So the Western Cape is not the only province. And if really is the Western Cape that is being affected, what more the rural provinces that have always been struggling with about 70 learners in the classroom. So we need more space, and we have thought that the June would then be used by the Department of Education to provide additional classroom in the form of what they call normal portable classroom or movable classroom that they will be constructing in order to ensure that they accommodate more learners in the primary school. But that has not happened. Therefore, it puts the direction in a threat that it will not be implemented as it was planned. We are in third wave, and therefore we need to reduce the movement, because the mobility is what is really spreading this. It's not only that the schools are affected at the level of work, they are affected by the communities, because the transmission is happening everywhere.
I have to leave you in just a moment, but before I do, very shortly, please, Mr. Maluleke, do you support a decision for schools to close at this time as we are going through a third wave or not?
Look, I have to be short and say my organization hasn't decided as yet. We haven't met. However, it is given that this is a third wave and the schools should be contributing towards reducing the mobility, and I will then be able to contact the department once my organization has taken a decision in favor of the fact that we should close the school.
We'll leave it there. Thank you so much. Mugwena Maluleke, the Sadtu General Secretary, joining us there, of course, with regards to their concerns raised regarding the 300,000 vaccines earmarked for teachers, saying it's not enough. More, of course, would be appreciated. Thank you for your time.